I wouldn't believe this if I had not been around situations over the years that had also caused me some bit of concern. This is unbelievable.
Here's a very disturbing story. FBI investigation into fraud at a Texas hospice, uncovering something much more sinister. The feds say the owner of the hospice ordered nurses to give patients an overdose of drugs like morphine to speed up their deaths. They say he even allegedly told a worker to, quote, make this patient go bye-bye. Trace Gallagher live with more on this story. Hi, Trace.
Hi, Gretchen. The FBI affidavit here really reads like a Stephen King novel, but the real-life alleged villain is the man who founded Novus Healthcare Services. 34-year-old Brad Harris is an accountant by trade with no medical training or license, and yet the FBI says he was directing nurses on how much medication to give hospice patients, ordering some employees to overdose their patients, making comments like, quote, if this blank would just die and you need this patient to go bye-bye. The affidavit says one employee refused to give a patient 4 times the maximum dose because he knew the person would not survive. The FBI does not say if any patients actually died as a result of overdose. It turns out hospice care providers don't make more money if a patient stays longer. In fact, it can be just the opposite. If patients stay too long, the provider can be forced to pay back the government. So the incentive is to have more patients with shorter stays. Now, the reason the FBI began the investigation in the first place is because of concerns that Novus Healthcare was recruiting patients who did not qualify for hospice. The feds say Brad Harris would also ask his employees to, quote, find patients who would die within 24 hours because that would save my blank on this cap, meaning, of course, the government limit on how much he could collect from each patient. So far, no charges have been filed, but that could change. Listen.
Brad Harris can be prosecuted under the aiding and abetting laws in Texas if he solicited, encouraged, or directed another person to kill one of the hospice patients.
On its website,
I know
Novus
this
says
is
it goes
disturbing.
the
I
extra
apologize.
mile to make people feel comfortable. So far, the healthcare provider has not commented on this case.
Wow,
Gretchen.
it's a huge story, and it's very disturbing. Trace, thank you.
Yeah, I apologize for posting it, but that's a sad reality in some cases, unfortunately.